Greetings. What's up, guys? This is Sharon from Go Gray Be Chic, and we are here today with Dr. Stacey Denise. How are you, girl?
Hey, how are you?
I'm
Sure.
wonderful, and I'm in cold Chicago. I don't know what the temp. I know you guys got some weather over there in Texas, right?
Yeah, I'm down in the Houston area, so I can't complain with the kind of weather you all get, but I just went out for my walk before we started, and it says 48. It's freezing to me because by the end of the week we'll be in the 70s again. So
Well, we won't see that for probably about 6 months.
right, right. No, I hear
Yeah,
you.
yeah. So I want to tell you guys a little bit of history about me and Dr. Denise. We serve, well, not serve, but we're in a YouTube community together, a membership where we are learning how to expand our brands and
Mhm.
serve you, the people, the women who need the help the most from us. And so we met in the YouTube community, and Dr. Stacy was talking some talk one day, and I was like, okay, I need to collab with this lady because I don't always, and I'm not taking anything away from doctors, guys. I don't always resonate with a whole bunch of doctors, right? Because she was talking like stand up for yourself. Don't go into these doctor offices and don't stand up for yourself. Be your best advocate, basically. And I was like, "Ooh, I like that because I am my best advocate. Only we know our bodies the best." So I felt like this was a perfect collab. I'm Sharon, and I've been on YouTube for about 6 years now. I've been in the hair industry for 3 decades. And I have a love. I can't show y'all my hair right now because it's not, I like wear these hats on cute days and not so cute days. So I'm gray, of course, and I embrace my gray hair at age, what was that? 51. So now it's been 6 years. I'm 57, just turned 57. And I'm just excited to have you here hosting you on the Go Gray Be Chic channel. Those of you who will watch this live and the ones that will come back and watch on the replay. And so I'm going to let Dr. Stacy introduce herself, tell what she specializes in, and then I'll come back and tell you exactly how we're going to get started with this chat. Take it away, Dr. Stacy.
Okay. Hey, I'm Dr. Stacey Denise. My full name is Dr. Stacey Denise Moore, but when I'm doing my brand and a part of the business is Dr. Stacey Denise. And I start off in pediatric surgery, and then I retired from that probably about a decade ago, and went into adult critical care. And then as I started coming in having my own perimenopause journey, I was like, okay, the dots were not connecting. And I was like, something is up, right? And I'm trying to sort out what's happening with my own body. And I started doing some more deep dives about perimenopause and then how it affects us as African American women. And I found that to be quite interesting how we have this long trajectory of perimenopause. Some people can go up to 10 years or a little bit longer. And why we have such a disconnect between the medical community and how Black women experience perimenopause. And so I was like, I had transitioned into lifestyle medicine, and lifestyle medicine brings about nutrition, good sleep, good social connections, um, good nutrition, and how to decrease the stress in your life. And they have 6 pillars that they deal with. But then as I started doing more investigation into perimenopause,
Have six pillars.
I was like, okay, how can I weave in this perimenopause not anti, I hate to say anti-aging because we age, I'm a firm believer, in God. And I'm like, God didn't design us the way he did just because he had a
Suffer,
method to the
right?
madness,
Exactly. He didn't
and
design us
so
like this to suffer. To
exactly,
suffer.
exactly. And I'm just like, so how can I work with the transition and not against it and make it seem like I need to be a 20-year-old when I'm 50 plus. I need to accept that I'm 50 plus. So how can we
Right.
make that transition a much better transition? And then how can we as women, especially African American women, go and be our best advocate, because we don't have a good track record with OBGYN. I don't know if you heard that story about
Yeah.
the
Oh,
black midwife that just recently uh, passed during childbirth, and she was a midwife. So I'm just saying, so
Really?
we continue to
Yeah.
still
But
have this
I know
disconnect.
the history of
Yeah.
us and like Serena's story and a
Yes.
whole bunch of other people's stories. Yeah.
Exactly.
Yeah.
So that's how I got into this work.
Okay, cool. So what we're going to start to talk about is like when you on my side, how I see women with perimenopause and menopause and
Mhm.
all kind of stuff, stress, and how I see it in my eyes. And we can talk about how back and forth, how I see it, and then how you see it when it relates to the body. Because we were talking earlier about the fact that when women always want to hear about products when the hair is breaking and the
Mhm.
hair is shedding and the hair is balding, it might be male pattern baldness, but there's always something that's screaming inside the body
Mhm.
that doesn't relate to many women until it shows up outside, or maybe in our hair, or maybe on our skin, or maybe as a dis-ease in the
Mhm.
body.
Mhm.
So when I see women, what I see is breakage. I see patches, some women who are wearing a lot of wigs, a lot of weaves, over a period of time. I see that. But then also with perimenopause, I see a lot of dryness. I see a lot of breakage. Some women want to wear chemicals. They want to wear color. They want to wear relaxer. I'm like, wait a minute. Okay, you got to choose one. And I had a client real quickly. I had a client who was wearing both. She was covering her gray and wearing a relaxer. I'm like, okay, now we got to choose. And then so I was talking to her about like her levels, her vitamin D, her iron, her potassium, her magnesium, all those different things.
Mhm.
And then she got her vitamin D levels checked. So we stopped relaxing because she wasn't ready to go gray. So she wanted to continue to color her hair. So she noticed and found out from her doctor, from her blood work, that her vitamin D levels were super low, excessively low. And once she got those up again, the hair just kind of just leveled off. It started growing again. We didn't go back into a relaxer either. I'm like,
Mhm.
okay. And so now she's just completely gray. So how do you see that? What do you see in the body when you see women complain about their hair or complain about their tired? Those are the
Mhm.
kind of things that you hear. And I hear, okay, what's going on with my hair? So
Mhm.
if you had a client like mine, like what are some of the things that you're seeing that it relates to perimenopause and menopause?
Yeah, sure. I mean, that's a good kind of, I'm gonna use the gestalt of how that saying, you are what you eat
Mm-hmm.
and you are what you don't eat. I think a lot of people, and I think we've been fed that just growing up. I can think of, as when I was a teenager all the way up until now, how we've had a complicated relationship with our hair, and the way that advertising has done. And this part is my own opinion, but observation, in terms of how society likes to force us to have products to think that's going to fix our hair. And we've never been taught how to even care for our hair. And it's not just the outside, put on a bonnet or, relax or color. How do we need to eat the best? Like you said, with that example of vitamin D, right? Biotin. A lot of people think that, oh, just put biotin on your hair and that's going to fix the problem. Well, sometimes you need a little bit of biotin in your body, but you don't even need that much.
Mm-hmm.
Protein is a good foundation. I had a patient that came and asked, my hair is getting thin and it's breaking. And we started going through nutrition, because that's a part of when I'm talking to my patients. What are you eating? And we talked about protein and how not only in perimenopause do you have an increase in protein requirement, your hair main building block is protein. And so
Mm-hmm.
how much are you getting on a daily basis? And we're going through everything. And it was interesting because she was like under eating protein, not to even just keep her whole body, sustained. I was like, so if you can't even get the proper building blocks for your body, your hair, in terms of bodily function, becomes a secondary thing. It's not necessary for survival. So if you're not even feeding your body to maintain its own self, pumping blood throughout the body, your heart is always constantly beating. I think we underappreciate all the things that our body does for us without us thinking about it. Breathing, our brain, doing all of the, electrochemical things it's doing inside the body. that takes nutrition, that takes energy. And then on top of that, we ask it for other things like hair growth, right? Nail growth. And if we're not given that proper building blocks, it's going to be hard for your body to be able to want to do extra processes like grow, good hair. And the vitamin D part is interesting because vitamin D serves two functions, right? In perimenopause, can act as a neurohormone and act on, mood stability. And then it can act as a nutrient too, and then fill in with different processes in the body. So vitamin D has a dual function. And I did a video not too long ago talking about how during this time, we're talking about wintertime, right? We have decreased sun and our vitamin D levels are already low. We got melanin, right? So our melanated skin might protect us from the sun, but it also decreases our vitamin D production. So we need to be out in the sun a lot longer than some other folks do. So if we have like all of these moving parts that we have to put together.
You just said a mouthful and I'm sitting there listening. So if you had someone with the dryness, with the thinning, I'm looking at my notes, with the shedding, with the breakage, with the slower growth, with, scalp sensitivity issues, and they come in and, because nowadays everybody, well, not everybody, but a lot of women, they want long hair. And my thing is, I always tell my clients, appreciate the hair that's on your head, right? Because I have a client that's in her 40s that has male pattern baldness. Now, then I have women who is in their 70s, 80s, and their hair is flourishing. So if you have male pattern baldness, like I know some people resort to wigs, which is fine. But if you have a client that comes in that's experiencing some of those, like where do you start with that patient? Like if they're experiencing, breakage, they're tired. You said vitamin D serves so many different things. You can get it from the sun. You can take a vitamin D tablet. You can get it from some of your foods. And some people, some of us don't love the sun. I can sit out in the sun for a long time. But of course, right now, there's no sitting out in the sun, even if the sun is shining. So I go to my front window and get some sun, but I definitely take a vitamin D tablet every day. So where do you start with that patient who might be having some issues? We lost. One second.
Hear me?
I can hear you, just can't see you.
Okay. There we go.
There we go. Oh, that's okay.
I would say first with the male pattern baldness, I would probably send them over to dermatology because there's a couple things going on. That to me that speaks to do we have some genetic things that could be
and she does. She does.
And so, so I'm just, especially, and I'm sure they probably have some family history that not just in the men, but the women. So they have to go down a deeper level of some genetics at play with that. So that's where I would send over to a specialist. But you do get some male pattern I don't want to call it male pattern baldness. You start to get that sort of looking like that male pattern baldness, but it's not the genetic part. The perimenopause and the menopause causes some of that thinning pattern because once you start decreasing the estrogen and the progesterone level, some of those androgen kind of hormones, like the male typical hormones, can rise. And so sometimes that can play a role into that. So when you start seeing those kinds of things with folks that don't have that genetic and family history component, doing a full set of labs to see where you are. I know most people like, at least one camp, like the GYNs are like, oh, if you're in menopause, you don't need labs. I'm like, well, sometimes you do to kind of sort out what's happening because you can't just always say that that's because you're in menopause. You need to be sure because you have other things that can mimic perimenopause and menopause, thyroid disease, adrenal insufficiency or adrenal fatigue, so those things are quite important. And I was going through with the chronic stress part you talked about. Vitamin C is also important in stress. Why? Because the adrenals, I'm sure you heard the people talk about when your estrogen is low, your adrenals kick in to take over the function of what estrogen used to do. You may or may not.
Okay. I know about estrogen, and I definitely know about adrenals because that has to do a lot with stress.
Exactly.
But I've never heard that. So it makes the adrenals work harder. Is that what you're saying?
Yeah. Okay. So your adrenals start to kick in and
Mm-hmm.
take over what your ovaries used to do, because your ovaries were the place in the body that would help with the estrogen production. And now, as our ovary function goes down in the perimenopause to menopause transition,
Mm-hmm.
then our adrenals kick in to take over. And so with that, um, vitamin C is an important nutrient or vitamin to help with chronic stress. It's not like you're going to go out and take a whole bunch of vitamin C and now stress is gone. But
Yeah.
your adrenals start to burn. They burn through a lot. So it's like,
Mm-hmm.
how do we support the body? Good nutrition, practicing techniques to help us decrease the stress,
Mm-hmm.
And it's very interesting that a lot of women that go through perimenopause always talk about some kind of magic veil that kind of like left, right? I've started becoming less tolerant to a lot of BS. And now, it's like I don't tolerate the things that I used to when I was a younger person, and they become more blunt or they get extra stress. And that also puts stress on the hair too.
Mm-hmm. So I got a question, and this is from a medical standpoint. Why do doctors, and I'm
Mm-hmm.
not saying all of them, like
I
when
know.
I talk about the doctors, I'm saying for our audience out there, it's not
Sure.
everybody, but like from my experience,
Mm-hmm.
I have a great African American female doctor. I
Mm-hmm.
love her, and
Mm-hmm.
she works with me. I speak my truth, what about my body. But why don't they recommend the labs? Like, I think people should be getting labs once a year, because a lot of times, they want to put you on this medication, they want to put you on that medication, and
Yeah.
it's like, can we check to see what my magnesium looks like, my potassium, my iron, my vitamin D?
Mm-hmm.
That that kind of creates some of those things that's going on with the body, which in turn creates what's going on with the hair.
Mm-hmm. Twofold. That's a loaded question. The reason why I'm saying it, because traditionally, like, so you have conventional medicine, and
Yeah.
then you have functional medicine, and then you have like integrative medicine, and a lot of
Yes.
people are like,
All the things.
all this. So the conventional medicine, I would say, not all MDs, but a good chunk, at least how I train. I The nice thing that I came through surgery, we like to test and find out what's happening in the body, so that way we can get a definitive answer. Do we need to do this or this? But a lot of like the primary care folks, I don't think that I can't speak for everybody in the profession, but you have to bump up against insurance companies, right? What are they going to
Mm-hmm.
pay for, and what won't they
Mm-hmm.
pay for? And so uh, because of that, people may be a little bit less inclined to want to get lab tests for every little, for every complaint or everything that's happening. I mean, you should be standardly getting labs. And when you go to the PCP, you should be getting like a set of labs each year to see where,
Mm-hmm.
your inflammation lives, where, your metabolic profile lives, and, certain markers. So that should be happening. Like if you're coming in with new complaints, that should still trip up somebody in the medical profession, and people that are in MDs. You might not be seeing an MD. Some people see naturopaths. Some people see integrative functional medicine providers. But they're a lot more, I would say, liberal in terms of getting labs. But also when you go into a lot of these functional medicine practitioners, and I'm going through functional medicine program myself, they do think a little bit differently, and they are much more liberal when it comes to getting labs. But that also comes at, they may not take insurance, that may be cash pay.
Mm-hmm.
And so, because of how we've been conditioned to work with insurance companies and relying on insurance, and I've always said, medicine is the only profession where we don't know the cost of anything, right?
Yeah,
Like
that's
when
so
you go, when I come to you and you're gonna do my hair, I got a whole list of how much your prices are, right, for whatever
true.
service I'm asking for, right?
Mm-hmm.
You go into a restaurant, you know what I mean? Like,
Yeah,
if you don't go
exactly.
to
I
more,
never even thought about medicine like
but
that.
when you go to the doctor, you don't know how much things cost, do you?
I never even
If
thought of that.
you go to the hospital, do you know how much a CT scan is? Do you know how
No,
much your Tylenol? I'm not trying to. I'm just
no,
saying,
I
when
know,
you
but
don't know the cost of anything,
yeah.
it's kind of hard to know. Am I getting adequate care? And what I mean by that, I'm not saying cost equals care, However, you become a different kind of consumer than you are as a patient. And I just put a reply to an interesting post that came out on LinkedIn talking about this: patients versus active wellness consumers. I was like, right there, consumer versus patient. If you go and break it down right to its root, to the root of the name, a patient is passive versus I'm being active in my own, clinical care or my own care. So that's where I talk about you having to be an advocate. If you feel like I'm not getting what I need with my own health care, then you need to go and find some folks who are going to be on your team, team you to get you what you need in your care. That is so important.
That makes a lot of sense. So, I never thought about that. So I guess the if we're not thinking about that, but the medical companies and insurance companies are definitely thinking about that. Like how much it's spending, how much, and do you really need what you're spending? Do you really need this test? Do you really need that test? So, but if you have a great medical doctor, like you said, on team you, then they're definitely gonna look out for you.
Yeah.
And know that they're going to provide the proper treatment that you need and not just throwing medication at you. Like, so how, like when you think about like the nervous system, the adrenals, cortisol, I mean, I study about all of that chronic stress because I'm highly anxious. I've been this way since I was a little girl. My mom is like a super anxiety person, right? She takes meds for anxiety, but I've learned how to just kind of calm myself. I meditate. I take time for me. I spend a lot of time with myself. And I noticed that sometimes, I have to take a break. Like I have to take a break from everything because I don't really see a lot of it showing up in my hair because I keep my hair just really, really short. Even though my hair is relaxed, I don't have a lot of the dryness and all that because I do drink a lot of water. I eat decently. But how, when we are in this stage, because I think I'm not fully in menopause yet. I think March will be my 12th month. It's coming up. So when you're talking about like the shedding and, the slower growth cycles and, how does someone just kind of help to reset that, the what's going on with their hair based on like what may be coming into the body, what they might need more of because of the period that we're going through, like as far as nutrients and water and not drinking a lot of caffeine. How would you look at that and recommend certain things to those type of patients?
I'm going to say this. I mean, if you're coming to me, I need a baseline. I do labs. Because I need to know where you are, right?
Yeah,
You
exactly.
could tell me, I eat great. Like a lot of people in my brain, I eat great, but I forgot to tell you I had, 2 donuts and, some cheesecake and all that stuff. But I eat great, so what is that? But what does that mean? Because it means different things to different people,
everybody,
right?
Yeah.
And so I think not only labs, but keeping a diary. Like I'll have my patient's journal, and just to be honest, I'm not here to be a teacher or a priest or a preacher, and I'm not here to tell you what you doing is awful. We're here for honesty and transparency, so that way we can sort out what's happening, right? It's like we detangling, a lot of these different tentacles that are like wrapped up into each other to sort out how best to help you get to where you're trying to achieve. And I like what you said earlier about, the woman who has short hair versus an older woman who might have longer hair. You got to go back and look at your family history because the women in your family going to tell you, the men too, like where you going to get, what kind of hair you can achieve. Everybody is not going to be, the same. And so we talk about those kind of goals. I mean, I don't come at it from just the hair part. I do the whole body.
Yeah, exactly.
And so like in perimenopause and menopause, as those estrogen, I think of estrogen as like I don't want to use this word because if I do, people gonna be like, okay, go out and put estrogen everywhere and life is good. Like, but estrogen, I think of it as the great conductor of a beautiful orchestra. right? It plays a role in all the different parts of the body, right? The thyroid, hair growth, nails, your heart, your pancreas, and your metabolic, your muscle, your bones. I mean, it's not a part of the body that estrogen doesn't touch, right? And so as that goes down, okay, well, if you as a violinist don't understand the other components of what's happening in the rest of your team, i.e. orchestra, you may be like, well, I'm the star, and start playing out of tune with the rest of, the orchestra, right? Because you don't have the conductor helping you. So that's what estrogen is, the conductor. And so now you have to and a lot of people start to, well, they don't start to recognize, but the body starts to show them you haven't been honoring other parts of your orchestra. So now you might have to tune up your piano, right? So you need to get that muscle strength back going. And I always hear this, I'm gaining weight in places I never used to, because estrogen, when it was plentiful, the whole goal of it is to help you ovulate, right? To have a baby. And so you have weight in your hips, right? Your buttocks. That stuff starts to change because I don't want to say we don't become men. That's not what it is. It's just that it's that buffer of estrogen has gone down. So certain hormones that never used to be a little bit louder become a lot louder. And so now you're gaining weight around your midsection because your metabolism is changing, because certain hormones in the body are becoming bigger players. And then that also downstream messes with the hair, because now it's like, I was eating the way I used to. Well, what did that look like? Let's start there. What did that look like? Because you may not have been getting the adequate nutrition and the vitamins and minerals that you needed to sustain your body.
So that's our next segment. You just you flowed right into that perfectly. Weight loss, weight, blood sugar, and metabolism. And like you said, many women say, my body changed after 40, 45. What used to work doesn't work anymore. And a lot of women get that little midsection during menopause, perimenopause.
Yeah.
So why is that? Does that have a lot to do with the estrogen levels? And because I know I have friends I've always been small.
Yeah.
And I have the potential to be heavier. But because I kind of watch, now I'm not perfect with my diet. Now, don't get me wrong, I'm not like a perfect patty.
Yeah.
But I do watch what I eat. I watch my snacks. I eat my snacks, but it's moderation. And so I hear women always say that they work on weight loss, but I think so many women work on dieting as opposed to changing their lifestyle, like changing how they eat, what they eat, how much they eat, because that matters. Like, the plate, is it full of meat and carbs and, veggies? But so how does that play with what you talked about before?
Yeah.
With the estrogen?
Yeah.
And why can't I lose weight now?
Well, yeah, the thing is that because like we were talking about earlier with the ovaries, right? The ovaries function, besides giving eggs for potential reproduction, is estrogen, right? And progesterone. And so as estrogen is, exiting stage right, saying thank you, taking that final bow, now the adrenal glands are asked to take over that job. And so you tack on stress, right? You tack on all these things. The adrenals are already doing a lot of work. And so when cortisol is elevated, it tends to contribute. It tends to help you pack on weight in the midsection. And so now you don't, and plus you don't need that. That's why I was making the mention about the weight distribution, the fat distribution. If you're not preparing yourself to have kids anymore, so you don't need fat on the hips and the buttocks and your thighs, not a fat getting ready to come, around that middle section. And so carbohydrate metabolism, or sugars, however you, and when I say carbs, I like to be a little bit more deliberate when I talk about carbohydrates, because some people like carbs, that means bread. Broccoli is a carb too. is a complex carb, but it's still a carb. So, really naming what is that carb. So are we eating, more refined processed sugars? I don't know if you know that the new food pyramid came out about a few weeks ago. And so before, at least when I can remember us growing up, it was bread was at the bottom of the pyramid and have tons of servings. And then like fats and meat were at the top, and you shouldn't really be eating that. And so we had a whole couple decades of this kind of low fat eating. Well, now folks then realize that you need the fat to help, with hair growth. Omega 3s.
Yeah.
I just recognize that omega 3s help with hair growth and scalp moisturizing, not putting it on, but actually helping the cells. So and then it goes back to what we're talking about with applying things on the outside without building on the inside. And so as that shift happens with your metabolism, and now understanding that when you have cortisol running the show, helping you with your nutrient distribution, when you're in that, I'm gonna call it fight or flight mode. So you're in this kind of constant stress, right? When you're in stress, you don't have time to be in rest and digest. That's the parasympathetic tone. So if you're always in this constant, gotta go, I'm super stressed, then your body is gonna pack on extra weight as if it needs to save it for a rainy day, right? Save it for a rain check. And it's much more to it, than just one hormone, but you asking it to do a lot of different things. And another thing estrogen does is it plays with insulin. The insulin play with the pancreas and how we utilize sugar too. So cortisol and insulin do this very interesting dance that also contributes to more I don't call it dysregulated, but more unhealthy ways of how we take on our extra calories. So and so that's a whole nother topic that we could do a deep dive on, but it all plays a role into, hair loss, right? And that's where I was saying, how does the body conserve itself? If you always living in damage control, like diet culture that you brought up, that's important, right? If your body doesn't know when it's going to get food or if it's going to be nourished well, it will hold on to every calorie to make sure that it's going to protect you on down the line. But we read that as, oh my God, my waistline is huge, I can't, well, your body is trying to protect you. And like you said, now you got to be more mindful of what's on your plate and how much is on your plate.
And I think that when you talk about that with weight loss and it's not always about, I think a lot of people think that the less you eat, then you can lose weight like that. But I think when you get more balanced meals and the body knows that it's getting those nutrients on a regular basis, balanced meals throughout the day, I think the body recognizes that, so that when you're getting, like you mentioned, the proteins and how, of course, hair is building blocks of protein. And so you're getting more nutrients, and then you can actually see that the hair is changing, that the hair is getting what it needs, along with the iron and the vitamin D. And I don't mean to keep mentioning those things, but a lot of times, we talked earlier about people just want products. They want products. They want products. But you got to understand what's going on in the body and why that weight is increasing and how to just minimize. Because everybody is not supposed to be skinny. Like you have healthy women who are voluptuous. I like to say voluptuous, with the hips. And I love to see beautiful, voluptuous women taking care of themselves, eating right. And everybody's not supposed to be skinny. So also talk a little bit about how sleep plays a role and getting rest. Like you said, you're always on the go. Parasympathetic nervous system versus the sympathetic. I know all about that.
Okay. Sleep is super important. We do a lot of things when we sleep. It's not just, okay, we are, resting to just sleeping and get up. We do, the brain is cleaning up a lot of debris. our immune system is repairing itself. You know, all of our systems are like recharging themselves when we sleep, and especially the brain.
Mm-hmm.
And so when you don't sleep enough, you start to you put your nervous system at like high alert, and that's like an extra stressor on top of everything else, right, that's going on from day to day. And now you're asking your body to do one more thing without giving it time to
Rest.
fix its own self.
Mm-hmm.
And so when you are not getting enough sleep, and some people are like might be fixated on, I must get 8 hours. I was just reading a study the other day saying that it's the quality of sleep,
Okay.
not the
Yeah.
quantity,
Quantity.
that is important. Because you could sleep for 8 hours and but still be waking up and like flipping and flopping and not really getting into
Mm-hmm.
that
Yeah.
deep level of sleep or that
Mm-hmm.
REM sleep.
Mm-hmm.
And then you
Yep.
still waking up and you're like, why am I tired? Oh
Tired.
my God, I
Yes.
don't know what is it? I slept for 8 hours. You're like looking under the bed, you like, count, oh, okay, I got 8 hours, but I don't
Right.
understand. Well, you probably didn't have that good deep sleep. And another thing that's interesting about perimenopause is that it increases your risk for sleep apnea. And
Mm-hmm.
so, and you may not know, like if you don't have a partner like rolling over saying, hey, you need to stop snoring, you may be having obstructive sleep apnea that could be disrupting your sleep. And then that increases the stress, right? And then that can also play a role in, hair loss too, from that perspective.
Yeah, and I don't think we look at all those aspects. We're looking at, okay, I'm using this product, I'm
Mhm,
using that product,
mhm,
and the coconut oil and the rice water. It's just
mhm,
like, I
mhm,
tell you, and I know some of that works. I know
mhm,
some of it works, from a hair perspective, but
mhm,
as we age and just like our normal aging, things are going to happen with your body, your
mhm,
hair, your skin,
mhm,
your eyesight, your
mhm,
all the things,
mhm,
your nails. I mean, so many things can be affected that you can see changes. And I'm naming all this stuff because sometimes you might wake up and like, okay, where did that come from? What is this? Why is my back feeling like it's feeling? Like I'm
mhm,
standing up doing hair, my body, I can't do those hours that I used to do. And I know that. And so
mhm,
I don't do that anymore. So I think
mhm,
it's a matter of two, of just listening to your body and knowing that it needs some rest. And I'm like you, I'm with you with the 8 hours. I'm like, I got to get my 8 hours. I got to get my 6 to 8 hours. But it's true because sometimes I have those sleepless nights where I don't go to sleep until 2 o'clock in the morning. And that's
mhm,
not good for me because sometimes I'm in the bed at like 9:30. So when you don't get that sleep, um, I feel like there needs to be some time during the day that you rest if you're not getting that much sleep,
mhm,
and we just go, 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 go. And sometimes your body just says, okay, you need to sit down, you need to shut it down. And then I just think sometimes we just don't listen.
mhm. I agree with that
Definitely.
for
So,
sure.
when you're talking about, I know you talked about the thyroid a little bit, the adrenals, and a little bit more of red flags, like symptoms that may suggest thyroid or adrenal issues. You mentioned, well, we didn't mention, but we're getting to it now. So
Yeah.
fatigue, hair loss patterns, heart
Mhm,
racing,
mhm.
cold
Feeling cold.
intolerance.
Mhm.
Yeah. Hmm.
Constipation.
Hot,
Yeah.
those hot flashes going back and forth, cold one
Yeah.
moment, hot the next.
I would say from the hot flash part, I would say that's more vasomotor in the brain associated with the estrogen coming down, and it plays with the thermostat in the brain. But you
Hmm.
get a cold intolerance. You become like more cold. You feel colder, even if it's warm. With hypothyroidism. And so the thing about that is that estrogen, like I said, estrogen is the conductor. So as it's going down, it causes some we call it subclinical, but low level thyroid dysfunction. So that when people see, oh, the TSH looks fine, yeah, it could look fine, but then you need to go down and look at some of the downstream markers from there to make sure that the thyroid function is truly okay. And so yeah, so the loss of estrogen can start to open up new doors to say now your thyroid is becoming dysfunctional. And we're in the wintertime. I just wrote a blog post about this. The wintertime also causes our thyroid function to decrease some too, so that you can have a little bit of hypothyroid, so people can notice that they have a lot of hair changes too during this time of the year.
So then what's the difference between hypo and then hyper?
Yeah, so hypo is like the slowing down of bodily function. So constipation, the weight gain, you got the hair loss, the temperature, and well, I'm gonna call it instability, but you feel colder. Versus hyper is like your heart rate gonna be going 200, beats a minute. You can't sustain your body like that because you'll die all the time. Your hair still could get thin and fall because you're in like hyperdrive. It's not even overdrive. You're in hyperdrive, and the thyroid storm can, if you don't control it, people can die. I used to see it on the surgical side when I was in surgery, and we would have to take the thyroid out sometimes, but you have to get them settled. So when you have hyperthyroid, that's like your body is like an incredible amount of energy. It's burning a lot of energy very fast, fast heart rate, fast. It's just intense.
So how we talked about this, like you talked about this in class when we were in a training. How can women self advocate more?
I think that starts with if it's hard for you to advocate for yourself, like just in daily life, sometimes you should just sit down and write out what your issues are, right? And what's happening with your body, and what do you need to talk to your doctor about. I wouldn't expect for I got patients coming to me because they've been on Chat GPT. I was like, look, Chat said I got X, Y, and Z. What do you think? I'm like, hold up, let's slow it down. But for people who don't have that kind of, that kind of gusto.
That's funny.
And I'm going through this with my mom. My mom she came up in that, she grew up with her parents coming through the silent generation. So that was like the Depression era. So she's a baby boomer. And when she's going to the doctor, she's going through her, she's at the doctor, and depending on the kind of doctor she gets, they may come in and just kind of not really interact with her very much, and she doesn't know enough to know that this is a problem and they need to be doing X, Y, and Z. So sometimes if you don't know, it is good for you to be on Google and just saying, hey, I got this, or you're talking to chat, and then come and partner with. But if you find that your provider is not taking you seriously, and you still know, because we all know our bodies. We're like, listen, something is not right. Sorry.
That's okay.
Something is not right. And
she's coming back.
What are we gonna do about that? And what are we gonna do about that?
And that's good.
And so if your provider, your healthcare provider, because sometimes it may not be a doctor, it could be an NP or somebody else. If they're not on Team U, then you need to find somebody who is gonna partner with you. Not talk down to you or be like, okay, well, I know this, because I came up in the era of training where the physicians were like, I would call them demigods. And so, even when I was training, they didn't like, talking to the junior residents. So I would have to talk to my senior resident, to talk to the attending who might have been standing right in front of me, but because of the chain of command. And so you can imagine, if you've been training like that for 10 years, you're going to bring that with you, that culture with you into the healthcare system, unfortunately. And so you may get that kind of interaction with your doc. And it's not, some of them may be like that baseline, but a lot of them bringing a lot of that, and I'm going to call it trauma that they had during training into the patient care arena. And so you have some that just stay distant, they kind of, and then they don't know how to work outside of being just, textbook, and we're going to do it this way, and that's it. Then you have some people who are just true healers, and they don't, they just know how to walk with you and help you through that. But if you don't have that voice for yourself to advocate for yourself, write it down. And then if you can find somebody to practice with, and you don't have to, you could be practicing out with who, talking into a voice memo and just playing it back so you can hear yourself, what you're saying, and then go in there and know that this is your health. You only get one time. You only get one shot at this thing. That's
Mm-hmm.
it.
I
So
know.
how do you want to show up for yourself?
Mm-hmm.
Because you matter, and you should get the good health care that you need.
Yeah, because my mom, she has issues. She has her little issues when she goes into
Hmm.
the doctor, and the
Hmm.
doctor tells her, "Oh, it's just all in your head. It's just all in your head." And she's like, "No, I feel it in my body.
Yeah,
It's not just in my thinking, how
yeah,
I feel." She
yeah.
feels certain things, and she knows that certain things are not, it's not like she's trying to get them to name something, but she
Right.
wants to figure out, okay, what's going
What's
on.
happening?
Yeah.
No, I hear you. Some of that comes from insecurity of not knowing, like because most people think I'm coming to the doctor and I have these sets of complaints, right? And if I tell you I don't know, then what does that mean about me being a doctor?
Mm-hmm.
You know what I'm saying? I mean, I know we're going past hair right now, but I'm just saying, what does that mean about me being the professional and I should know those things? We don't know everything in the whole human body. That's nuts. But
Mm-hmm.
I'm just saying, but you have a lot of not just personalities, but people's own insecurities that they bring to the table. Just because you're going to a
Mm-hmm.
doctor doesn't mean that they're not insecure. So
Yeah, you
sometimes
got
that
that
may,
right.
show up as, I know all, or, that's all in your head. It's easier for me to say it, it's all in your head. And then for somebody to say, I don't know, right? Because then what does that
Mm-hmm.
mean about, you know, my knowledge base? So,
Mm-hmm.
but if they don't know, then just be like, hey, I know why this happening. I'm gonna go find somebody else to help me out because something not right. And it could be a part of normal aging. And then what can we do to make that better? Right. Here are
Mm-hmm.
some things that we need to be working on, lifting weights and eating better. And these are the nutrients that your body needs. We're getting older. So your oxidative stress might be going up. So these are some of the things that we need to be doing to do X, Y, and Z. But not a lot of people um, may be trained in that, right? We train to give a medicine, but past that, that's why I've always, that's why I'm like into functional nutrition and
Mm-hmm.
functional medicine because I'm like, okay, but we beyond just one pill, and then what if this pill doesn't work, and then the pill causes
Mm-hmm.
anything other middle? Did we
Yeah,
get the foundation correct, or
exactly.
I
Yes.
mean, I could put paint. You know what that was that saying? Put lipstick on a pig. We need to go to the basics and then
Oh,
go from
yeah.
there.
Start from the foundation. Yeah.
Yeah.
So when I think about like going gray and, women's identity and
Mhm.
emotional health, and I know that a lot of women today that are going gray are not like our grandma. My mom is she's a baby boomer also,
Okay.
but the going gray for her was not the going gray for like our generation that's going on, because you see all these influencers out here with their beautiful hair, and they have an identity that is totally different from the identity that they had when they were coloring their hair. Because sometimes when I think about women that still color their hair, it's no judgment against them, but it's just like, they feel it's still some type of emotional um, thing going on where they think it's so many things, that gray hair makes me do this, gray hair makes me look
Mhm.
old, gray hair is
Mhm.
going to age me, gray hair does not mean I can still relate to, the youthful part of me.
Mhm.
That's what kind of society tells us. So what do you think, like when I think about being behind the chair and how gray hair impacts your identity and all of that? Because I had the same issue. I didn't stop coloring my hair till I was like
Mhm.
what 51. So there was a lot of identity crisis that was going on with me, and the lack of confidence, and like, oh, I'm going to look this way, I'm going to look
Mhm.
that way.
Mhm.
So do you get a lot of that when women come in to see you, especially going through perimenopause and menopause?
Mhm. No, I mean, no, because we haven't really talked about um the beauty aspect of, when I say beauty, I'm talking about like what does society claim is beautiful? You know what I mean?
Mhm.
Like, listen, I'm always like pro advocate, pro. Well, listen, I don't. Whatever you want to do, that's what you want to do. But make
Mhm.
sure that you're doing it for you, not
Yes,
because
exactly.
somebody told me I should look, like X, Y, and Z. Because I used to wear wigs, and I just wear my natural hair, and it's starting to gray. And I'm like, oh well, it is what it is. I mean,
Mhm.
I cannot stop the clock. It's coming.
Yeah.
And I was like, that day will come when I'm not here anymore. So while I'm here, I need to live the best life I can while I'm here. So, but I hear what you're saying about the gray, because people think you're getting old. But what does old mean? I
Yes.
guess that's the question we should be asking ourselves.
Yeah.
What does old mean? And I know that, this is like deviating from hair and nutrition, but at the end of the day, it's a part of it too, right? I mean, what is that? How do you want to age
Yes.
gracefully? Do you want to
Yes.
be strong? Like, I take care of women who get hip fractures, right, as you get older because of the osteoporosis. I'm like, I don't want to live like that. So what are the things I could be doing to
Now.
make sure that I
Mm-hmm.
keep my bone strength, to make sure that I keep skin elasticity? I don't need to run around put estrogen on my face, or like you
Mm-hmm.
talk about dyeing the hair. I mean, it's gonna come. That time will come.
Yeah.
And
Because
it is.
I had a client, well, subscriber. She emailed me. I was reaching out to people who had purchased some of my apparel over the last 30 days, and I
Okay.
sent them a personal and private email. And she sent me these pictures back, and she said that she purchased there was a woman at church, and she was watching the woman every week at church, and the lady's hair had a little bit of gray in it, and she was like, she's like, she must not have gotten an appointment to get her hair colored. And so then the next few weeks she saw more gray, and she was like, oh, she must be going out her gray. So she actually purchased a t-shirt for that young lady, and so she gave her the t-shirt. But then when she sent photos of what she looked like with her gray hair, and I was like, oh my God, you are beautiful. She had this chocolate skin, and she sent me several different photos when her hair was like a little short afro when she started growing it out. And then she responded the other day and she said, I'm so glad you didn't say, you look so good for your age. Like, I never tell people that you look good for your age, because like that's so it's like, what does that really mean?
It's a
Like,
big.
how am I supposed to look at 57, whatever your age is, or 70 or 80? Like, I just went to an 80th birthday party. It was one of the most exciting birthday parties that I've been to, compared to some of the 50-year-old birthday parties I've gone to. So it's like, age is like really just a number. It's almost, it's to me, it's more like how you feel with the gray hair, how you present yourself with the gray hair, and really how you present yourself with color, even if you're still coloring your hair and
Yeah.
decide not to go gray. It really does
Yeah.
not matter. And like, I love what you said. It's up to you. You can't let your husband, your significant other, your kids, like, you need to stop coloring your hair. You got to stop when you want to stop, because you got to stop when you're ready.
Yeah. And I mean, what is, yeah, no, I hear you that too. Then it's like, okay, well, gray hair is like is it a marker of time? I mean, because it's a part of biological process, right? If you, that's interesting that you say that about looking good for your age, because I was just looking about Gen Z. A lot of people talk on social media was like, Gen Z looks so much old they look old for their age. I'm like, I was like, if life wears you out and you worried about things, you're gonna wear that stress. You can wear it in your
Yeah.
hair, you can wear it on your body. I mean, you're gonna wear it in a lot of places.
Yeah, that's so
So
true. That's so true. So what other aspects of the body, outside of what we talked about already, like, oh, I know what we didn't talk about that I wanted to ask you about is hormonal replacement.
mm,
I've never had it. I
mhm,
know people who, one of my girlfriends, she's like 10 years younger than me, and she's about to start with the pellets. I've heard a lot about the pellets, but I
mhm,
don't know a lot about hormonal replacement. So where
mhm,
where does your practice and some of the things that you recommend to women, is it something that you recommend to women, something that you don't? I know everybody is different, everybody's situation is different, but how do you
mhm.
handle hormonal replacement?
I said that that's personal. I mean, I'm not gonna be like, you must do X, Y, and Z.
Yeah.
You, you this is how I approach medicine. I'm gonna give you, the however you present,
Mhm.
whatever the data shows, and we'll have a discussion about these are the options, right? Because I have some women who like they do not want to take hormones, period. I respect that, but we got levers that we can pull to help you through that. And some people, not everybody has problems with hot flashes or the
Mm-hmm.
vasomotor symptoms. Not everybody has the traditional presentation of perimenopause. I got some women who like, I didn't even know I was. I just one day I just knew I wasn't having cycles, and it's like year 2. So am I all right? I'm like,
Yeah.
sure. Yes. Like, okay, you know what I mean? Like they
Right.
have but you have some women who have a lot of symptoms. And so like right now when you talk about hormone replacement, so depending on who you talk to, at least on the more menopause society side, is menopause hormone therapy. So what you're
Oh.
really trying to do is to replace, not replace, you're not replacing, you're just giving enough to take those symptoms away, right? Um, the hot flashes, the night sweats, the mood swings. Some people, well, it's not really estrogen replacement or estrogen therapy is not like to treat mood swings, but at least to for vasomotor symptoms. Some people tell you dementia. Uh, you may hear this, but it's not been substantiated. Is that dementia is you decrease the risk of dementia. It does help in osteoporosis. So because as you get older and your bones get more fragile, estrogen is known to play a role in that for sure. And then cardio heart protective. But it doesn't protect your heart. It just helps. It's not like if you take estrogen, you're not gonna ever have a heart attack. So, some people have that registered. That's not the function of it. It's just to help to bring back that, conductor to the rest of your body. So that way your body is trying to support itself the way it knows how when it has estrogen present. So you have some women who can take it, some women who cannot take it. And then, to me, it's a personal decision. We'll look at, your labs. I get labs. I know you have some folks who are like, you don't need labs. I get it because I want to know where your progesterone is. Are you coming to me
Mm-hmm.
for sleep? What are you coming to me for? And then what do those hormones look like in addition to the other markers? And where do we need to start, putting your puzzle piece together or your own
Mm-hmm.
puzzle for you? To me, it's personal. Well, it does. It's not a one size fits all. Like you could start doses at one size fits all, maybe, but not like okay, because you this age group, you must have this. No,
Mm-hmm. Yeah, exactly. Because everybody is different.
yeah,
Yeah, yeah, definitely. So as we wrap up, because I don't see any questions down here, I asked
okay,
some people to put some questions down here. Um, I've been having across the screen where women can follow you, but I
okay.
have one more question for you.
Hmm.
Um, what for like a woman, say, let's just say her name is Kim and
Hmm.
she's turning 60 next year
Hmm.
and she's overall pretty healthy, but she has some things to work on. She might need to work on her blood pressure a little bit. She might need to work on the cholesterol a little bit. What
Hmm.
is an overall care might look like for her, like day-to-day care, like eating, moving her body, like what will be important for her to be doing as we wrap up? Just a basic, not
Yeah, no, I hear you.
everybody is different, but just a scenario.
Oh no, I hear everybody's different, but some basic things you should be doing as you getting older, especially if you're talking about that 60-year-old age group and
Uh,
then beyond. Even now, like even if I'm in my 40s and getting, because you're gonna be 60,
mhm,
and then moving your body. And I'm talking about get outside, get in 150 minutes a week of cardiovascular activity. So walking is free.
mhm,
I mean, that's just free. And if you got smart watches, you know, put that sucker on and try to get your heart rate up, to your target heart rate group for um and 150 minutes a week, that's you what 30 minutes 3 times a week or 5 days a week, 30 minutes 5 days
mhm.
a week. So I mean, are you kidding me? You can only get if you give your body 30
Exactly.
minutes out
Right.
of out of all the time that we have, I mean that's like a gift to yourself. And I
Mhm.
think it's more so than just like the work, it's a gift to yourself. So like now, um because I do telehealth, so I'm at home, doing my medical practice. So I have to be deliberate about getting up to do my,
Moving.
yeah.
Mhm.
And I get out and walk every day. And then nutrition, like, what are my healthy fats, protein, prioritizing protein, but also getting fat in because, your hormones need fat. I mean, your hormones are fat, so you need that. It's not like it can just like poof out of the sky. So it's important to get those. And then also looking at the vitamins and minerals and just making sure, not just, okay, I'm going to just get it in a pill form. You need to eat because the food has other cofactors that we haven't even, discovered yet. And it's like, okay, yeah, you should have just probably ate that than taken whatever formulation that is, because you don't even know how that's affecting your liver. Getting good sleep, and then being around people who bring you joy.
Yes.
That's important because, life is already stressful, or we make it as stressful as we want to. I'm gonna put it like that, because you get to pick and choose. At 60, you get to pick and choose. Who am I gonna be around? I'm not the 5-year-old that have to be, that's like subjected to my parents and I get to do this thing. And so I think doing things that make you happy and that also stimulate your brain power, because dementia is also, can creep up. So keeping your brain power going and having good relationships, good food, and moving. Yeah, it sounds simple, right?
Yeah, it does, but it's like 100,000 moving parts.
But yeah, I mean, it's simple, but we make it harder than it has to be sometimes.
Yeah. But when you think about it, like, I love that you said the person in their 40s, because I know like a lot of women, in their 30s, and I'm not even going to start with the 20s, but the 30s and the 40s. And it's just like, oh, she going through this. Oh, she going through that. But what a lot of women, I didn't realize, is that some of those things start in your 30s and they start in your 40s. And you really trying to figure out, okay, my body is changing, but they're not relating it to perimenopause or menopause, because no, that happens to me when I'm way down the road. And so, and if you don't have a doctor that says, okay, let's look at this or let's look at that, it's like the reality that is not there yet, but the body is already changing. Once you get past like 35 and on to your 40, it's already changing. Because I look back at some symptoms that I was having early on in my early 40s that I know for a fact that it had to do with my body, my hormones changing. Because I had a baby late in life. My first one was 28 and my second one was 39. And it was weird because the second child that I had, I felt more vibrant than when I was younger. The pregnancy, because I had to have another C-section, but I chose that because I'm like, I don't need to be proving nothing to nobody. We're going to go on here on this date and we're going to have this baby. I don't have to go through all that 48 hours situation that I did. My doctor gave me a choice. So it was kind of like it wasn't easy, but it was much easier than before. But I was older, but my mindset was different. And so I got through it a lot smoother. It was more of a smooth situation then. But I think we don't look at it as, okay, it's you 30. It's not like you're getting up there. And I'm not scaring anybody, but your body is starting to change. That's why women always look at their age and they like, oh, I need to start having these kids. And, I need to have a baby now. It's time. So it's a lot.
No, it is. I think that's why it's important to have conversations like this, right? That women talking to other women to educate them about what's happening, through the different periods of their lives. But just like you said, right, that we found that we have a longer trajectory of perimenopause that we're not talking about. So like you said, you recognize that earlier you had these changes, and now it's here. Now it's like,
because I even heard about this book called The Wisdom of Menopause. I can't remember the doctor's name, but she was on Oprah, and I was in my mid to late 30s. I'm like, I don't need that book. But I remember that book, and there's a few things that I remember her talking about. She talked about, diet and hot flashes, and how if you have a lot more sugar in your diet, I don't know how true that is, then it could potentially cause you to have more hot flashes. But I mean, sugar in your diet causes inflammation. So, it's so many different things that when you have so much sugar, and then you if you're stressed out, and then you're drinking a lot of coffee, caffeine, you're drinking a lot of wine, all of that can play a role in your stress levels too, especially if you're already stressful.
This is yes. And then the estrogen like takes away that protection, that protective. And so you're just like, it's screaming. You got like 5 alarm fire from all the things you mentioned. And now now your body like that conductor is leaving, and it's like, okay, well, who gonna take over here?
So what helps? So what can help take over that? Nothing can replace it, of course.
Well, that's why you get the menopause hormone replacement, because some people want to, take that. Yeah, you want to give back, that
what you're missing.
Yeah.
Or what's leaving.
Yeah.
Oh, okay. Okay. So is there anything like naturally you can be doing outside of, hormonal replacement or food or exercise and stuff like that?
I think all those levers are helpful, because some women, not every woman, and when they, start to lose estrogen, has problems with, vasomotor symptoms.
All the things. Okay.
But diet is that's key. The sugar and the, exercise and wine. I know some people are like, oh, I can drink that. Your liver becomes less tolerant to processing alcohol, as you lose that estrogen effect. So I'm like, if you can help with a lot of lifestyle changes, and I know it's a lot of them we talked about, right? Stress is one. Stress is a big one, because then that allows you to be able to receive some of your nutrients. I was in a lecture where they were talking about this was a man who had all the stress from work, and he couldn't even like digest his own food. So can you imagine that if you like even if you eating the best diet, you can't digest your food because you so revved up. Your gut is a it's like the nervous system and the gut talk to each other.
That is so true. Because I have a client going through that right now. She was here yesterday, and she is like extremely stressed with some stuff that's going on in her life, and she's having gut issues. She can't hardly keep any food down. I'm like, girl, if you don't want to check out of here early, you got to start taking care of yourself. Yeah, that is so true. And then that's a man.
And that's why I'm saying that rest and digest. So like when I'm eating, another one of my lectures, it was so interesting. She was like, oh, this was a good saying, and she said, you want to chew your liquids, right, and swallow your solids.
Okay, let me
think about that one.
Chew your liquids and swallow your solids.
So that means you need to chew enough the solid food that is like a liquid that you can swallow it. Not whole, not chunks. And I was like, so she said, I want when you eating, you need to be able to chew your food that much that you can drink the solid food you put in your mouth.
Wow.
I was like, how many people actually chew like that?
I know I don't.
Okay, I'm just saying. So I'm just wondering, when you think about that. And I was, I was like, I don't do that. I was like, I might be eating and reading and doing.
Right.
And then your gut, you never even allowed your gut to receive the food that it needs. And now you're asking it to break down big chunks of food and then nourish your body. Oh, it was it was a nutrition class. It was deep. I was like, wow.
Yeah, that's deep, because we're not even gonna get on like the whole situation when it comes to what happens when the food does move through your body. And what that looks like.
I hear you. I just wanted to leave you with that, because that stuck with me. I was like,
Wait, say that one. I need to write that down.
Yeah, right. I thought that was. I was like, wow.
Chew your food. Yeah. No, chew your
liquids. Chew your liquids and swallow your solids. And if you can do that, you're doing your body a good favor.
Wow.
And be peaceful too.
And swallow your solids. Wow, that's deep. I never heard that before.
Yeah, right. I didn't either. I was like, oh God, yeah. So now I'm like very
good.
But now sticking every time I'm like, okay, I gotta sit here and really be with my food.
Because like you said, again, that's that sympathetic nervous system that's rush. You got to hurry up and eat. We got to do this. And then we thinking about the next thing we got to do. And that's what I'm working on, just being in flow, just calming down, because like whatever you rushing trying to do, like you can't just make it happen. I'm working on that. It's a work in progress too. It's a work. I'm an empty nester now. So I'm like,
I hear you.
Yeah, it's a beautiful thing too.
Yeah.
I'm really working on just kind of slowing down and not doing all that. Because like when we have these YouTube channels, and it's like I used to, when I first started, I would be getting this content out, getting that content out. And I'm like, you know what? No, I'm not doing that no more. So like we talk about in the class, you don't have to do 6 to 10 videos every single month. If the content is good, people resonate with it, and you are providing content that your listeners need and want to hear, then that's what's most important, even if that's just one video per week. So
that's right.
That parasympathetic and that sympathetic nervous system, I always think of the like a parachute. Just coming down, just calming down, calm down. Yeah. Especially this time in our lives too, because it's and this time in the world. So much is going on.
That's what I'm saying. And you consuming a lot of energy when you stay in that state, right? And now I'm asking my hair to do, do his job too. And I'm taking up and I'm not feeding myself. I'm just, so it's a lot of parts.
Yeah, it is. And that's why my Heal Gray Hair series comes out in March.
Okay.
And it's just like, when I talk about the things, I'm like, y'all don't stop doing this. Y'all stop doing that. Like, it's not just about the hair. You got to understand everything that's going on with the body. Yeah. So this was amazing to have you on. Yes, I had fun too. We have to do this again. And I'm sure people will come back and watch. So we have to stay in those comments and see if people have comments for us we need to answer. Yeah. But I want to say thank you for joining us here on Go Gray Be Chic. And I'll definitely make sure that this is shown on your channel as well. So you, I'm gonna stay warm here in Chicago. Right. You stay. Well, you're gonna have some warm weather. Oh, that makes me. This makes me
count down to my warm.
Yes, yes, because like your arm, you see me over here with turtleneck on. I mean, I don't have to be like that in the house, but I didn't go. I didn't go out today. But I can't wait to get out to the lakefront, because that's my favorite thing to do in the summertime. Get some. All right.
All right.
Take care.
Yeah, you too.
All right. See you later.
Bye-bye.